Hi class, my name is Anne and I'm a coding instructor here at Ultimate Medical Academy. And today this lecture is going to be about the introduction to our CPT coding manual. So if you don't have this coding manual in front of you, please pause the video and go get it. So that way we can navigate this together. Okay, let's begin. This is our current procedural terminology manual. So let's open up the front cover and get familiar with it. You will see on the inside of the front cover is 2 columns of information. On the left-hand side, you'll see some symbols, and then you'll see modifiers, and then modifiers over on the right-hand side as well of the page. Your tabs to the book are over here. What I want to point out here is these symbols we will see throughout the book. The modifiers, I like to refer to this as my quick reference guide to modifiers. There's a complete and detailed description in Appendix A that we will go over in much more detail in another lecture. But let's talk about these symbols and what they mean. These symbols are telling us that there's something unique about the code. For example, the symbol with the 0 and a line through it is letting us know that that code is exempt from modifier 51, which means we can't use that modifier 51 with that code. It'll all make sense. Believe it or not, there is logic in this book, and it's just understanding the language. The next symbol that we see is a triangle. That triangle is letting us know that the procedure code description, the words after the code have been substantially changed from the prior year. Remember, these books are updated every single year. Since these books are updated, new codes get added. All those new codes will have a solid dot next to them, to the left of the code. You'll always see your symbols to the left of the code, and then your description follows to the right. Now text gets revised. Text is all throughout the CPT book. It could be in the form of guidelines at the beginning of the section, beginning of the subsections or the group of codes. Any new text will have these 2 triangles, facing triangles, at the beginning of the new text and at the end of the new text. So everything between the triangles will be new or revised from the prior year. And usually also that new and revised text is in a different color of print. It could be green. If that's the case, the reason for that is it's saying, hello, pay attention to me, I'm important, please read, make sure you're coding correctly. The next symbol is the plus sign. The plus sign is an add-on code. It indicates that that code is additional to another code. It cannot be used by itself. It cannot be listed first on that claim form or in the code sequence. It's always used in addition to another code, hence add. Add means plus. Some other symbols that you'll see, sometimes we'll be looking for codes. I've been looking for a code and it should fall in numerical order, and it's not where I think it should be. And that's because it's out of numerical sequence. So I just keep reading till I find the code, and once you find that code, there'll be that little number sign indicating that it is out of numerical sequence. Codes get deleted. And maybe they come back. They get recycled or reused for another procedure. If that's the case, we're going to see this little dot, this open circle next to that code. Some things get put on, we can bill for, but and give to a patient, but they haven't had, they're still in that approval process with the Food and Drug Administration, and those would be pending. And for those procedure codes, you'll see the lightning bolt next to them. And this is one that for codes that we're now using a lot more starting this year because of COVID, is the star sign, the star symbol. That is next to any code that is a telemedicine code. Patients and doctors are now having their interactions over the phone or over the internet versus face-to-face in person in the office. And if that's the case, those codes that are approved telemedicine codes will have that star in front of them. Now here's a little commercial alert. With those telemedicine codes, we will always use a modifier 95 with that procedure code. But that's for another lecture. Okay, let's continue to flip the pages of our book, and I want you to locate the introduction pages. This is several pages long, and it gives us all the details about the book. The topics in the introduction are the section numbers and their sequences. We have the sections from evaluation and management, anesthesia, surgery, radiology, pathology, laboratory, and medicine. Then, of course, it talks about the instructions for the use of the code book. There's another whole page and a half. And then what I want you to locate, flip the page, and I want you to find the format of terminology. This is really important. Format of terminology will be here in red. It's a short paragraph, but it's a vital paragraph. We have to have a good understanding of how we read the codes and their descriptions here in the CPT book to ensure that we're choosing the accurate code based on the procedure. We will talk about that in a little more here in a couple slides, but I really want to give you the heads up alert. This is very, very, very important. Now, as we go along, we see that since these codes are updated, new codes get added. How does that occur? It occurs through physicians. This book was developed by physicians, the American Medical Association. So if a physician has a new procedure that he's performing and he wants to get a formal CPT code in it, this will explain how we get it and what the requirements are to get that code in the book. Also talks about general criteria for Category 1 and Category 3 codes and those specific requirements. Okay, here's another heads up. Guidelines. These is very important to understand. Guidelines are the rules to coding. They're our playbook. It's not about memorizing these codes or memorizing all these rules. It's knowing where to go to find the guidelines. And the beautiful thing about the CPT book is that the guidelines that are specific to a subsection are both at the beginning of the subsection, and then those guidelines that are specific to a group of codes are right at the beginning of those group of codes. So it's not like we have to go searching through the book or going different sections. It's all very well organized. Now, if you forget what an add-on code is, that's okay. It's right here in your index. It has a nice paragraph that talks about add-on codes. It also has a paragraph that talks about what a modifier is and when we use it. It explains what place of service and facility reporting is. The place of service is exactly what it means. Take all of this terminology at face value. Place of service is the location where the patient and the physician interacted. Was it in the office? Did the doctor come out to the patient's home? That's a different place of service. Did the doctor see the patient in the emergency room? That's a different place of service. Here's a little tip, folks. When you get out in the field and you start to make your little cheat sheet folder, your own little personal desk reference, find all the places of service that your doctor commonly goes to see his patients and make a little record of that, because this happens to be one of the most common errors on a claim form is that place of service code. So just pull out the most common ones where the doctor sees his patients: the hospital, the office, maybe he goes to the nursing home, and etc. It also talks about unlisted procedure or service codes. Unlisted procedures are just that. Their description begins unlisted procedure integumentary system, unlisted procedure respiratory system. This is the code of absolute last resort. And the reason for that is that's the description. Insurance companies have no way to price it. We can bill $5,000, but the insurance company doesn't have any idea on how to price it. How they do learn to price it is by the physicians adding a special report. And that report is dictating and stating all of the details surrounding that procedure, from the equipment, the time, the prep. Every little minutia of detail has to be included in that report. So that report gets attached to the claim form. And then the insurance company can take a look at it and say, okay, well, here's all the details. Dr. Smith billed me for $5,000, but I say we think it's only worth $1,000, and that's what we're going to allow and pay on it. But here's a little note with that, guys. When you submit a claim with an unlisted procedure code, be prepared to wait and wait, because it takes months to get that claim paid for. Hence the very reason why we want to try and avoid using that procedure code. The goal is to get that money turned around, to get that money back from the insurance company as quickly as possible. So remember we were talking about symbols, and I forgot what one meant? Guess what? It's right here in our book. We can just go find out. It's also got an alphabetical reference, a proprietary laboratory analysis, and other references. Okay, now it's time to get into this semicolon. This is an extremely important symbol. Okay, that semicolon is a dot and comma. It's in the middle of a code description. It helps to separate the main portion of a code description from the unique parts of that code. For example, we have these two codes: incision and drainage of pilonidal cyst, simple, and then we have just complicated. The common part of the procedure code will always be before the semicolon. So technically, when you see code 10081 and you're putting that on a claim form, it's not just saying complicated. It's indicating and saying that this was an incision and drainage of a pilonidal cyst, complicated. You'll notice that when we do take a look at these codes, the indented codes are just that. Their code description is indented from the code above it. In other words, there's variables, there's variations to this incision and drainage. If it was a simple incision and drainage, then by all means we would use 10080. But if it was a complicated incision and drainage of a pilonidal cyst, then we don't need both codes. We only need 10081. Okay, in summary, guys, know where all your symbols are, get familiar with your book, read all the codes and their descriptions, follow the guidelines before you finalize your code, and as always, please don't hesitate to reach out if you have any questions. We're here to help.